Welcome to the Part B and B Supplemental Program Terms Report webinar. I and the presenter, Brian McBee, come from Ryan White Data Support. We're a contractor that has been hired to provide technical assistance for reports like the PTR. Kabibi Matthews Brown from RWHAP will also chime in at times. And we are going to start the webinar now. Hi, Brian.
Hey, Rachel. Thanks for that. And thank you to everybody for joining the webinar again today. So here's the outline for today's presentation. We're going to start off with a little bit of background information. And then after that, we'll go through some step-by-step instructions for how to access the PTR. We'll briefly go over the Grantee Contract Management System, or GCMS, and then we'll review how to complete the various sections of the PTR. Finally, we'll close out the presentation by looking at some additional TA resources and wrap up by answering any questions you may have. Before we start, I do want to take a moment to mention the updated instruction manuals for FY25 for both reports. The FY25 Ryan White Part B PTR manual is complete, and we're working on getting it posted to the RWHAP website. The B Supplemental manual, though, will be available soon. It'll be at the same link on the RWHAP website. The manuals are the best resource for you when completing your report and contain step-by-step instructions. So let's get started with some background information. All Part B X07 and Part B Supplemental X08 recipients are required to complete a PTR for their award. You'll complete a separate PTR for each award that you receive. So if you get both a Part B and a B Supplemental award, you'll have two separate PTRs to do. In the PTR, recipients report on the allocation of their grant funding for the budget period. Recipients can access and submit the PTR through the HRSA electronic handbooks for EHBs. The
Brian,
PTR, yes.
I'm gonna unmute everyone for a second, and people are gonna type in whether they can hear us or not in the chats. I have a feeling we can't be heard. JK just emailed me saying they can't hear you. Okay, here, let's see the chats. I hear you, I can hear. Okay.
Okay, should I continue on
so
for now?
It's just JK.
Okay. So back to the presentation. So the PTR, you're good, utilizes the Grantee Contract Management System, or GCMS, which we're going to go over a bit more later in the presentation. Looking at the submission process for the PTR, you'll start by accessing the PTR system through the EHBs. After that, you'll need to complete the PTR, which includes adding your allocations for core medical and support services to contracts in the GCMS and completing all the required fields in the actual PTR itself. Once you've done all that, you'll validate your report against HAB's reporting requirements and then submit it to your project officer to review. We're going to go over each of these steps a bit more in depth on the upcoming slides. Starting off with how to access the PTR in the EHBs. So as was mentioned earlier, the PTR is submitted in the HRSA EHBs, specifically the PTR web application. You'll need to make sure your account is set up with correct permissions to be able to access the report if you're a new user. If you need any help doing that, though, you can contact the EHB's Customer Support Center for help, and they can walk you through the process of adding permissions to your account. So let's start walking through the step-by-step instructions for accessing the PTR. You'll use these instructions for both Part B and B Supplemental. On the home page, after you log into the EHBs, you'll hover over the Grants tab, which is up at the top of the page. And then on the drop-down, which you see here, you're going to select the Work on Other Submissions link. From there, you're going to be taken to the Submissions All page. If you scroll down, you'll find a list of submissions for your agency in a table down below. And again, remember, if you have both B and B Supplemental, you'll have 2 PTRs, kind of like you see here on this slide. To access the PTR system, you'll select the link over on the right under the Options column. Before you've started working on your report, it's going to read Start, and then once you've actually started working on your report, it's instead going to read Edit. From there, it's going to take you to the PTR inbox. You can see your report in the center of the page in the inbox. And to open your report, you'll select the envelope icon under the Action column. The first time you open your report, it's going to read Create, and then after that, instead it'll read Open. But we're actually not going to start there. Instead, we're going to begin with the GCMS, which you can access by selecting the Search Contracts link, which is in the navigation panel over on the left side of the screen. So let's take a look at the GCMS before we get into the actual PTR. The GCMS is a data storage system for Ryan White contract information. Its purpose is to decrease data entry burden on recipients as the information entered there is used for multiple reports. Your contract information, for instance, will also be used for the Ryan White Services Report, or RSR, thereby eliminating the need to re-enter all of your contract information for that report. Recipients will enter their contracts into the GCMS with a separate contract for each agency that's funded to provide services with your award. Then the PTR automatically looks in the GCMS for any contracts that overlap the report's budget period and automatically pulls them into the report. The PTR specifically is going to pull over contract information to populate your list of funded providers in the CLC section of your PTR, as well as funding amounts for core medical and support services that will populate in the allocation report section. Typically, recipients will add their contracts for the budget period into the GCMS during the completion of the PTR. You'll need to make sure that you have a contract for each organization that is funded to provide services with your award. This does include your own agency as well if you provide services. Your agency's contracts in the GCMS should align with the dates of your budget period. So for Part B, that would be from April to March. You should not have a contract that exceeds 12 months. Also, prior year's contracts need to be preserved. Each provider must have a separate contract for each year that they're funded with your award. We're not going to walk through the entire process of adding contracts for this presentation, but we do have step-by-step instructions for that available in the GCMS manual, which is available on the RWHAP website. So now we've taken a brief look at the GCMS. Let's talk about the PTR. The first thing I want to mention, though, is the navigation panel. It's always there on the left side of the screen while you're in your report, and it's how you'll navigate the system and complete various report actions. Up at the top, you can use the link here to get back to the PTR inbox that we saw earlier at any time. Also, as previously discussed, you can access the GCMS by selecting Search Contracts under the Manage Contracts heading. The navigation heading is where you'll find links for each section of the PTR itself. Also, under the references heading, you can find the links for both the validation rules document and the Part B and B supplemental PTR instructions documents. In the actions section, you'll find links for both validating and submitting the PTR, which we'll talk about a bit more later. And then finally, down towards the bottom, we have options for printing and exporting both the CLC report and the allocations report, should you need either of those separately. So after clicking on the envelope icon that we saw a few slides ago, you're going to be taken to the first section of the report, which is recipient information. All the fields here are going to be pre-populated from the EHBs, starting with your agency's mailing address up at the top. And down here, we have your agency's EIN, UEI, and then the contact information of the person responsible for the submission. Just make sure that everything's accurate, and if you make any adjustments to what's on this page, make sure to select the Save button down at the bottom right. So let's go ahead and move to the next section of the report, which is file upload. For Part B and B supplemental, you will have a few files that need to be uploaded with your PTR. We'll go over exactly what those are in just a second. Looking at the file upload section here, you have a couple of different tables. Up at the top, you have a table for reference documents, like the PTR instructions, which you'll definitely want to check out for assistance with any of the uploads that you have to do here. Scrolling down, further down the page, we have where you're actually going to upload your files. Some of the files that you need to upload are going to have templates available, and you'll see them listed in this section here. You'll select the download template link, fill out and complete the document, save it to your computer, and then select the upload link on the right for the appropriate file to add it to your report. For any additional document that you need to upload that doesn't use an existing template, you'll instead utilize the supplemental document upload feature. For that, you'll just select the Upload Supplemental Document button, locate the document that you have saved on your computer, and add it to your report. For the Part B PTR, there are 5 documents that must be included with your submission, which include the SF424A, Budget Narrative Spreadsheet, Implementation Plan, Contract Review Certification, or CRC, and the Early Identification of Individuals with HIV/AIDS, or EHA plan. For the Part B supplemental PTR, you again have all of those same uploads, except you do not have the EHA plan for that award type. If you do have any questions about the required documents for your PTR submission, the best resource for you is going to be your project officer. The next section of the PTR that we're going to discuss is the Consolidated List of Contractors, or CLC report. This is a list of all organizations that are funded to provide services with your agency's grant. The CLC report pulls information directly from the GCMS. It's going to pull in every contract that overlaps with the budget period and list it here. Review the CLC report for accuracy and completeness by double checking the contract dates, the funding amounts, and the funded services. You can select the expansion button to view the services for each provider. Remember, again, all agencies that are funded to provide services with your award, including your own if you provide services, should have a contract in the GCMS and should be listed here in the CLC report. If you need any assistance with updating your contracts in the GCMS, again, you can always check out the GCMS instruction manual or definitely reach out to us at Ryan White Data Support. If you add or edit any contracts into GCMS after you have started the PTR, you will have to synchronize those updates with your report. You'll know the report needs to be synchronized if there's a yellow warning banner at the top of the page, like what you see here. You have to synchronize in order for the contract updates to reflect in your report. So make sure that whenever you're ready to submit, you don't have any pending contracts to synchronize like you see here. To go ahead and synchronize contract updates, you'll select the Synchronize All button that shows up within the yellow warning banner. On the next page, you're going to see a summary of the updates that were made to the GCMS. Just review them, make sure everything looks as expected, and then select the Synchronize button at the bottom right. Once you've done that, any updates you've made to your contracts are going to be added to your report. So now we're going to look at the last section of the report, the allocations report. The allocations report is split into a number of different tables. So we're just going to start at the top and scroll down through the page. We're going to walk through the Part B PTR first, and then we'll go through Part B Supplemental, since there are a few differences between the two. For both of those, though, you can't leave any fields blank. So if you have no allocations to report for any of these categories, just make sure to enter a 0. And additionally, only whole numbers are allowed. Can't do any decimals. So the first section, again, this is for the Part B PTR, is for award information. This table is for your total award amounts. There are 5 total fields that you have to fill out, 1 each for your total Part B base award, ADAP earmark award, ADAP supplemental award, emerging communities award, and your MAI funding. If you don't receive one of those award types, just enter a 0. The next table on the page is the allocations by program component table. Please note it's divided up into 3 columns here that are each pertaining to a different award type. So you have your base award in column 1, combining your ADAP earmark and supplemental awards in column 2, and then column 3 is your emerging communities award. There's a few different fields to fill out in this table. For each row, you're going to enter the amount allocated to the indicated service in the row from each award type indicated by the columns. Starting up at the top, we have allocations for ADAP, which includes 1A, ADAP services, row 1B, which is ADAP health insurance, and row 1C for ADAP access, adherence, and monitoring services. The next couple rows are entirely blacked out, rows 2 and 3. Those are for Part B health insurance premium and cost sharing assistance, and Part B home and community-based health services. Allocations for those 2 services for your Part B X07 award are going to be entered into your contracts in the GCMS, which is why you see them completely blacked out here. Rows 4A through 4D are all going to relate to consortia funding. So if you don't have any consortia funding, you'll enter 0s for these rows. In 4A, you just have 1 field to fill out, which is for HIV care consortia from your emerging communities funding, which is in the 3rd column there. And then rows 4B through 4D are all for consortia services that are non-client services. 4B for consortia administration, 4C for planning and evaluation, and 4D for clinical quality management. Again, all for consortia funding. Down now at the bottom of the table, there are just a few more fields to fill out. Rows 5 and 6 are both going to be pre-populated entirely from the GCMS. So those numbers will sum up from the contracts that you've entered there. The first 4 emerging communities funding, and the second for state direct services. In row 7, though, you're going to have to enter funding allocated for clinical quality management, again, from your 3 different award types. In row 8, you have planning and evaluation, and then in row 9, you have recipient administration. Moving on to the next table, we have values for all the core medical and support service categories. Everything in this table is going to come entirely from the GCMS. So if a value does not seem correct, you're going to have to modify the associated contracts for those services in the GCMS. And you'll see all the core medical and support services listed here. We're going to scroll down kind of quickly, go through all those services, and get to the next table in this section, which is the MAI allocations by program component table. This table is where you're going to report on all of your MAI funding, entering values for MAI education and outreach, and then the non-client services, which are clinical quality management, planning and evaluation, and recipient administration. Below the MAI table, you're going to see a checkbox for the 75% core medical services requirement. Select this checkbox if your agency received a waiver for that requirement. And if you have any questions about the waiver or if your agency received it, make sure to reach out to your project officer. The last section of the page is the legislative requirements checklist. There are no fields here for you to fill out, but it's a very helpful tool to check and make sure your agency is in compliance with the various requirements of your award. So each field will show your allocations as they relate to the associated legislative requirement. All the fields here in the checklist are going to populate once you have entered and saved your allocations data on this page. The first table you can use to check for the 75% core medical services requirement. The next box is going to be for clinical quality management. Remember, your clinical quality management allocations may not exceed 5% of your award or $3 million, whichever is smaller, which you can check here. And then the last box is for planning and evaluation and recipient administration. Planning and evaluation and recipient administration each can't exceed 10% of your award, and the 2 combined cannot exceed 15% of your award. So all the way down at the bottom of the page, once you've gone through the whole page and you've entered your agency's allocations, just make sure to select this Save button down at the bottom right. So let's quickly review the allocation report for Part B supplemental grants. This section is a bit simpler for B supplemental X08, as there are only 10 fields to complete. Starting up at the top, you have award information with just 1 field, which is just going to be for your total X08 award amount. Next is the planned funding by program component table. This is going to be similar to that which we saw for Part B X07, but since we just have the 1 award type, we're just going to have 1 column to fill out. Again, the first 3 rows are for ADAP services, health insurance, and access adherence monitoring services. Rows 2 and 3, you'll remember in Part B X07 were completely blacked out, but the supplemental, you must report allocations for Part B health insurance premium and cost sharing assistance and Part B home and community-based health services in this table in your allocations report and not in your agency's contracts in the GCMS. So it's a little bit opposite of how it's done for Part B X07. Rows 4A and 4B are again for consortia funding. 4A will populate with your agency's consortia funding total entered into contracts in the GCMS. And then in 4B, you'll enter the total for consortia administration. Row 5, same as Part B X07, it's going to populate with the total of your agency's direct services funding entered into contracts in the GCMS. And then rows 6, 7, and 8 are for clinical quality management, planning and evaluation, and recipient administration. So enter the amount of funding allocated for those activities from your award. The last table is for your core medical and support service allocations. Again, this is going to come entirely from the GCMS. So if you need to modify one of the amounts here, you'll have to edit the associated contracts in the GCMS. And then scrolling quickly down to the bottom of this table, we also have the core medical services requirement waiver checkbox. Again, select the checkbox if your agency received a waiver for that requirement. And if you are unsure of it or have any questions about it, reach out to your project officer. So now that you've completed and saved each section of the report, you're ready to move on to validating it. You can validate your report by clicking on Validate, which is under the Actions header in the navigation panel. Once you do, the system is going to let you know that it's processing your validation request and that it may take a few minutes to complete. Just wait a couple of minutes and then select the Validate link again to refresh the page. If you see a green congratulations message, then you have no validations to address and you can go ahead and advance to submitting your report. Otherwise, you're going to see a table of validation results that I'll show you what it looks like in just a sec. But first, I want to talk about the types of validation messages that you can receive in your report. There are 3 different ones: errors, warnings, and alerts. Errors have to be corrected. You cannot submit your report if it has an error. Warnings should be addressed whenever possible to prevent your project officer from returning the report back to you. But you are still able to submit your report with warnings by adding a comment for each one that you receive. Alerts, again, you should also try to address whenever you can, but you are still able to submit your report if you have any alerts in them. If you make any changes to your report after you validate, you will have to validate again, just using the same steps that we talked about on the prior slide. So here's a sample validation results page. If we scroll down, you can see in this example, this recipient just has one error because their clinical quality management allocations are too high. We exceeded that legislative limit. So in this case, this recipient would need to adjust their allocations, save that page, and then revalidate. The last step then, once you've taken care of your validation results, is to submit your report. So to do that, you'll select the Submit link, which is in the navigation panel. On the next page, which you see here, enter a comment in the text box with any meaningful feedback that you have about your submission. Select the checkbox certifying the data in your report are accurate and complete. And then lastly, you'll select the Submit button. If you need to make changes to your report after you have submitted it, just ask your project officer to return your report to you for changes. So we're coming to the end of the presentation for today. If you do have any additional questions on anything that we presented here, please feel free to ask them during the Q&A portion, which we'll get to in just a moment. But first, let's take a look at the resources available to you if you need some additional assistance. The RWHAP website is where we currently are housing all of our online resources. The first link that we have here is for recipient resources, which include the PTR manuals and the GCMS manual. And then the second link we have is for the HAB policy notices page, which includes PCN 1602, which is the document that houses the definitions for all core medical and support services. The two main TA resources you may need for the PTR are going to be us at Ryan White Data Support and the EHB's Customer Support Center. I'm from Data Support, and we can help with accessing and completing the PTR, as well as making any changes or updates to your contracts in the GCMS. Otherwise, the EHB's Customer Support Center will be your best contact if you have any issues with your account permissions. But remember, there's no wrong door for TA, so no matter who you contact, we'll make sure to get you to the right place where you need to be. So thank you, everybody, again, for tuning in for the presentation. I'm going to turn it back over to Rachel, and we'll go through the Q&A.